And it's time that we dive into yet another series lecture of Manthan. And today we have our very renowned expert, Shri Dr. Satbir Singh Khalsa ji. I request Bandita ma'am to felicitate Shri Satbir Singh Khalsa ji. I apologize for the mispronunciation of the name earlier. And now, thank you, sir. A few words about Shri Satbir Singh Khalsa ji. He is a PhD scholar and has been fully engaged in biomedical research on the efficacy of yoga and meditation practices in improving physical and psychological health since 2001. He has practiced Kundalini Yoga since 1971 and is a certified instructor. Dr. Khalsa is a director of research for the Kundalini Research Institute, a research associate at the Benson Henry Institute, a research affiliate of the Usher Center for Integrative Medicine, and an associate professor of medicine at Harvard Medical School in the Department of Medicine at Brigham and Women's Hospital in Boston. He has conducted clinical research trials evaluating yoga interventions from insomnia, post-traumatic stress disorder, chronic stress to anxiety disorders, and also for adolescents, public schools, and workers in occupational setting. Dr. Khalsa works with the International Association of Yoga Therapists to promote research on yoga and yoga therapy as the chair of the Scientific Program Committee for the annual symposium on yoga research and as editor-in-chief of the International Journal of Yoga Therapy. He is medical editor of the Harvard Medical School Special Report, An Introduction to Yoga, and chief editor of the medical textbook, The Principles and Practice of Yoga in Healthcare. We all welcome Shri Satbir Singh Khalsa ji today amongst us.
This is considered by me to be a second home in India because my career has been devoted to research on yoga. And Swami Kaivalyananda began remarkably 100 years ago. So that to me is incredible. This man with this incredible vision of the importance of research on yoga, he would be honored to see what has occurred over the past 100 years in the movement in yoga research. So if we could have these lights off, then we can see the screen better. My first presentation is really on the psychophysiology and neuroscience of yoga and its relevance for modern healthcare. So I want to start with the popularity of yoga, because this is something that has also grown very dramatically over the past 100 years in the West and even in India. These are statistics from the United States government, which does surveys in the United States of how many adults are practicing yoga. What you can see is that in 2002, that was 5%. Now, in 2022, 16% of US adults have practiced yoga in the past year. That is remarkable. That is a major movement in the culture, in the society. Whenever 16% of the population is doing anything, this is major. The other thing that's very remarkable is this trend. You see this incredible growth over the course of these years. In this 10-year period, it doubled. So this is really remarkable. But we also have some statistics on the popularity of yoga in India. This is from 2020, 4 years ago. At that time, this survey of 112,000 people in India indicated that 12% of population was practicing yoga. So it is growing here as well. This is another remarkable statistic from the National Council of Education, Research and Training here in India. A survey of 4,200 schools showed that 97% of those schools have some kind of practice of yoga. So that is very interesting and remarkable too. And if you see this kind of popularity of yoga in India, you would expect to see evidence in the culture. And so we do have some evidence of the culture. And part of this has also been inspired and increased by the activity of Prime Minister Modi. In 2014, he spoke to the United Nations and said, we should celebrate International Day of Yoga. So in 2015 was the first celebration of International Day of Yoga, and here he is in New Delhi, and he brought some friends to celebrate with him. And at that point in time, we had this 50,000 people celebrating the first International Day of Yoga, and this has continued. Around the world, the Indian consulates in each country are actively involved in celebrating International Day of Yoga on June 21. And of course, this has happened in India. This is out of Mumbai. This is the aircraft carrier of the Indian Navy. And they're all celebrating on the International Day of Yoga. They're practicing yoga. And that, of course, has penetrated the population as well. It's in the advertising industry. So here you can have Jivan Shanti, Shanti guaranteed with this yoga image. So that popularity is growing and continues to grow. And that actually also supports the research on yoga. And so now I want to share with you some of the science behind the research that has informing us how yoga works on the mind and on the body, the psychophysiology of yoga. And this is a growing area of research. These are review papers summarizing the research of many studies on different areas of how we understand how yoga works on the mind and on the body. So here, this one is on psychological benefits. This is body awareness and pain. This is on stress, immune functioning, neurophysiological, neurocognitive mechanisms, and self-regulatory mechanisms. So this is an indication that a lot of research is being done to understand how yoga works on the mind and on the body. And in our book, The Principles and Practice of Yoga in Healthcare, we have a chapter dedicated to this research on the psychophysiology of yoga. But to give you a sense of some of the history, some of the early research was dedicated to studying yoga masters. And this was the biggest study of that kind. In the 1950s, this team of researchers traveled all over India to find these yoga masters and record their activity. And they concluded that physiologically, yogic meditation represents deep relaxation of the autonomic nervous system. Autonomic nervous system was considered to be automatic. You had no control. And yet, through these yoga practices, these individuals were able to control their autonomic nervous system, which introduces this major idea in the field of yoga and of mind-body medicine of the self-regulation of internal state. The ability through these practices to be able to control your internal functioning, physically and psychologically. Why is this important? Modern medicine does not know about this virtually. This is not part of modern medicine. In modern medicine, the doctor does something to you, gives you a pill, gives you a surgery. But here, through these practices, individuals are capable of controlling their internal functioning. So that's very important. Another important thing is the autonomic nervous system, which is involved in regulating stress and emotion. And this tells us that yoga may be very good for the ability to control stress and emotion. Now, of course, yoga includes asanas, and we know that when you practice asanas, your body changes. So there's a lot of research studies that have been done on asana practice, and we know that we see changes in things like flexibility and muscular endurance and muscle strength. This is no surprise. If you stretch, you become more flexible. So there's a lot of research evidence, it's very strong evidence, that asanas do change the body in a very positive way. We also know that we practice relaxation techniques in yoga, like Shavasana, Yoga Nidra. And of course, in the West, this is a different practice. We have studies that were done in the West on progressive relaxation. It is very similar to Shavasana. So this is one study that was done on relaxation, showing reductions in stress, reductions in anxiety, increases in the experience of relaxation, and even reduction in heart rate over a short-term practice. And they also measured the stress hormone cortisol. You can see after Shavasana, this decrease in the stress hormone cortisol, and the controls had no change. Another important component of yoga practice is pranayama. The most common technique is long, slow yoga breathing. And many studies are now being done on slow breathing. This is one example of that, showing that these individuals in this study were given a stressful situation. And what you can see in those that did not practice the pranayama, they had an increase in the experience of stress. The other group, the active experimental group, practiced long, slow breathing. And what you can see is that their stress level was much less. So we now know that slow breathing and other kinds of pranayama generate this anti-stress response, regulation of emotion. There are now also studies that show that slow breathing can regulate pain, it can regulate emotion, and it's even a highly efficient form of breathing. So this is very powerful research that is now happening. And we're starting to understand those regions in the central nervous system that are responsible for the effects of slow breathing. And then finally, the other important component of yoga practice, of course, is the meditative component, the focus of attention. And many studies are now being done with very modern technology to be very precise about how the nervous system is working when the brain is meditating. And one question that has been asked is, do the brains of people that meditate behave differently? Do they function differently? And we see the answer is yes. This is one such study. They see changes, and those changes are involved in the attention network of the brain, and also those regions of the brain that are involved in emotion and autonomic function. So this fits very well with what we observe in practice, that meditators are able to control stress and emotion more effectively. And the attention networks of the brain, well, meditation is the focus of attention. So when you practice meditation regularly, you get better in regulating your attention networks and therefore your control of thought processes. Another kind of study is looking at changes in brain structure. This is well known. This is called neuroplasticity. We know that when we engage in a new kind of behavior, the brain changes its structure to accommodate that new activity. So if you're learning to ride a bicycle for the first time, the brain makes structural changes to allow you to do that kind of activity. So yoga is an activity. Can we change brain structure? Yes, we can. And this is an example of that. This study looked at the tolerance to pain, and it looked at long-term yoga practitioners, people that have been practicing yoga for many years. You can see that their tolerance to pain was in general, in these black dots, much higher than those people that were not practicing yoga. In this study, they also did brain imaging to calculate the volume of the region of the brain involved in pain regulation. And what you can see is that volume of the region of the brain is higher in the long-term yoga practitioners than it is in the non-yoga practitioners. And when they made a correlation between how long they had practiced yoga and what the size of that region of the brain was, there was a significant relationship. The longer they had practiced yoga, the larger that region of the brain was. The brain has changed its structure. So these are very powerful techniques. They tell us that yoga can change the activity of the brain, and it can also change the structure of the brain. This cartoon reads, "Meditation isn't what you think." There's two meanings to this cartoon. Number one is that many people don't understand what meditation is. But the other one is, when you meditate, what happens? Well, when you start, you are able to focus your attention. You are chanting Om, or you are chanting another mantra, or you're focusing on a candle. You hold your attention. So thinking stops for a little bit. And then after a few seconds, suddenly you notice you're thinking about something else, and then something else, and then something else, and then something else. And then suddenly you remember, I'm supposed to be meditating. So then you bring your attention back. And this happens over and over and over again to everyone that meditates. So in real life, meditation is a cycle. It's a cycle of focus of attention with interruptions of mind wandering. So really, if we want to study meditation, we need to study both. We need to study both focus of attention and mind wandering to really understand what the mechanisms are behind how meditation works. And that was done in a science paper by Harvard researchers looking at mind wandering. And they found in their study that people's minds wandered frequently regardless of what they were doing. And we know this is common knowledge. Everyone has mind wandering. If you're waiting for a bus, if you're sitting in the doctor's office, your mind is wandering. The interesting finding was that people were less happy when their minds were wandering than when they were not wandering. So why is mind wandering associated with emotional disturbance or stress? And the reason is in the content of mind wandering. The most important thing to us is survival. So when our mind is wandering, we are thinking about survival. Will I be able to pay the rent next month? Will I be able to get dinner tonight? Will my son get into university? Will I be able to afford the university? These are survival issues. Whenever you have a thought about survival, it is uncertain. So that causes a little bit of a stress response. If you are constantly thinking about stressful situations, you become stressed. Over time, that becomes chronic stress. That can become a mood disturbance, and you can get major depression or anxiety disorder. So what happens when you meditate? Well, you focus your attention. The attention networks can only do one thing at a time. That means mind wandering stops. So, at least for the amount of time that you are successfully focusing your attention, it's kind of like a holiday from mind wandering. It's silent. But more important is that when you practice this over time, you are learning to work your own attention networks. That means you get better at focusing your attention. And as you practice meditation regularly over time, you find that you are able to spend more time in the focus phase, and you are able to notice more accurately when your mind is wandering and bring it back to the focus more quickly. You become better at meditation. And what that means is that you become less stressed. You become more in control of your own thought processes. This is what Patanjali's Yoga Sutras are all about. They're about self-regulation of thought processes. And that leads you to these deeper experiences, ultimately of samadhi in yoga. We can see this pattern in the brain of mind wandering and focus. So these are people in the brain scanner trying to meditate. And this study was able to show what regions of the brain were being activated during the focus phase, which is here, the dorsolateral prefrontal cortex. This is in the frontal lobes of the brain, where the executive regions are, where the attention networks are. So that makes sense. But when the brain goes into mind wandering, it's an entirely different pattern of activation, much more diffuse collection of brain regions. This has been called the default mode network. So now we are starting to understand from the neuroscience of the brain how the brain works when we are meditating. And we are starting to understand the connections in the brain. We know that the prefrontal cortex has inhibitory connections to the limbic system, which is the emotion and stress part of the brain. So when you meditate, you quiet the limbic system, the emotional stress brain down. You make it more calm, you quiet it down. In fact, there are studies that now show that people who meditate for a long time, their limbic system actually becomes smaller because they become less reactive. They become less emotional, less stressed. So we're starting to really understand how the brain is working over the long term and what the benefits are over the long term with meditation practices. Another very modern technology that's being used to study yoga is so-called gene expression. Changes in the activity of our DNA. We can't change our DNA, that is our inheritance, but we can change gene activity. This is called gene expression. We can make some genes increase their activity and some genes decrease their activity. So if you smoke cigarettes and eat a lot of fatty foods and don't get exercise, cancer genes will start to increase. If you do the opposite, you engage in stress management, you eat healthy foods, you get good activity, those genes will then decrease their activity. So yoga is a healthy behavior. Can we see this? Yes, we can. We can see epigenetics affecting gene expression. So this affects the genes themselves, making their changes in activity. So negative genes will lead to negative consequences such as depression, anxiety, inflammation. And positive gene expression can lead to positive mental health, reduced inflammation, and delayed and healthy aging. And in this review paper, they concluded that the results of the studies reported in this review demonstrate that mindful practices modulate the epigenetic landscape, leading to increased resilience. Therefore, these practices can be considered to be valuable tools that complement pharmacological treatments when coping with pathologies related to stress. And this is another review paper on this same topic. Individuals who practiced yoga and mindfulness meditation have reduced methylation levels of various enzymes involved in epigenetic mechanisms, as well as reduced pro-inflammatory markers. Mind-body therapies are shown to be integral in positively affecting health, not only through changes in our mental and physical health, but also by influencing expression of our genetic code. And this is one example of a study using a yoga meditation practice. They studied it on very stressful individuals, and they found that the practice of this meditation suppressed the expression of inflammation-related genes and upregulated or increased the expression of genes involved in antiviral and immunoglobulin responses. So positive effects on immune function, negative effects reducing inflammation. So stress management is one of the major outcomes of yoga practice. In fact, systematic reviews support this. This review revealed that most types of yoga have positive effects on stress reduction in healthy populations. This is another review reporting on physiological outcomes, not just self-report measures. Things like reduced evening cortisol, ambulatory blood pressure, heart rate variability, blood glucose, and even blood lipids, indicating improved regulation of the sympathetic nervous system and the hypothalamic pituitary adrenal system, the two systems that are involved in the stress response. And just to give you an example of some of the research, this is from our study. This was a 5-day intervention in professionals with stressful occupations. And we were able to show that there were reductions in perceived stress at the end of the program that were maintained at the long-term follow-up, and increases in resilience to stress that were also maintained. We've also done this in education professionals, mostly teachers. And again, this is the teacher in the black bar showing reductions in perceived stress and in resilience to stress increased by the long-term follow-up. And the controls that did not practice had no change. Now, another thing that occurs with yoga practice over time is an increase in mind-body awareness. And this is also known, and it has become a very popular term, mindfulness. It's the same thing. Mind-body awareness is mindfulness. And this is a study of long-term yoga practitioners. And they showed that the higher level yoga practitioners, those that were practicing more, had higher scores of mindfulness than those that were practicing moderately or those that were practicing very little. We can also see those changes in mindfulness over a short period of time. So this was changes in 6 weeks of practice with young adult musicians. We gave them yoga for 6 weeks and we saw an increase in their scores of mindfulness compared to controls that did not practice. We've also seen it in these workers, these high-level professionals. After a week of yoga, we were able to see increases in mindfulness that were maintained 2 months later. We've also seen it in those teachers, the education professionals, these significant increases in mindfulness compared to the controls. Now, of course, the word yoga means union, and historically, yoga was a contemplative practice. The goal was improvements in spirituality. Now, as we practice yoga over the short term, whether it's a few minutes or a yoga class, we see these reductions in psychophysiological arousal, improvements in physical and mental well-being. You feel a little better after a yoga class. You're more calm, you're more focused. But as you practice yoga regularly, over weeks and months, you start to develop these skills of mind-body awareness, mindfulness, resilience and tolerance to stress, and overall self-regulation of your internal state. But many people who adopt a yoga lifestyle and typically practice longer, months and years of practice, they start to talk about a transformation, a psychological and philosophical transformation. People will say things like, yoga changed my life. Now, why is that significant? Well, it's not like yoga fixed my knee, I no longer have back pain. No, they're saying yoga changed my life. This is what Patanjali's Yoga Sutras are all about. And so that is very important. And then over time, with typically longer practice, mostly from the meditative component, we have these unitive states that we experience, this sense of peace, tranquility. And that leads to these states of transcendence, flow, a deeper transformation, and a change in life meaning and purpose. And we can call this pure spirituality. So one thing you can see from this model is we're making changes across broad spectrum of human functioning, from the gross level of muscle and connective tissue to the deepest experiences that humans can have. And we can also see that in global human functionality, from physical and mental health and performance to stress and emotion regulation, awareness, mindfulness, and ultimately this important state of metacognition, to the deepest experiences of positive behaviors, well-being, values, life purpose and meaning, and even spirituality. The other thing about this model is that we can look at this and apply it to human life, to human circumstances. So these characteristics can be very important in different areas of functioning. So if you are a student in university, it's very important to be in control of your stress because students are under a lot of stress. If you are trying to study, it's very important to have good concentration. So that's very important. And we also have research that it really supports each one of these. So we have a lot of research, very objective, strong evidence. Over the past 2 to 3 decades, through techniques of brain imaging, epigenetics, and biochemical research, we have enormous new information about how yoga works on self-regulation and mind-body awareness. But we have very little research, but it is becoming an area of important research to study the effects of spirituality from yoga. So let's now take this to a very important area of modern life, and that is healthcare, medicine. How does yoga have benefits there? Well, you can see in some of these characteristics how some of these things might be very important. Physical body health, the health of spirituality, increasing mind-body awareness, which can change behavior, and stress regulation, which is a very strong risk factor for many diseases. So it makes sense that we can think about yoga as a therapeutic intervention. Now, historically, yoga was not a system of medicine. Yoga was a contemplative practice whose goal was the achievement of these higher states of consciousness. But in doing that, we optimize the function of the mind and the body. And so if we are optimizing the function of the mind and body, it makes sense that it might be helpful to use this in patients, which there are disorders of functions of the mind and body. So we see the first evidence of yoga as a therapeutic intervention in a formal way here in Mumbai in the 1920s. And this became popular in India. Yoga therapy started to grow. There were hospitals and clinics. We have a clinic here for yoga therapy. And in 1963, the Indian government commissioned this book by Swami Kaivalyananda, Yogic Therapy. And this has now been followed by many, many books on yoga therapy in India and in the West. This is a book called Yoga as Medicine by my colleague Timothy McCall. But there are now even books on yoga therapy for specific disorders. Yoga therapy for insomnia, yoga therapy for cancer, yoga therapy for diabetes. books and books and books. They become very popular. So, what is the most important thing in modern medicine? The most important thing that is challenging modern medicine is an epidemic. This is an epidemic of so-called non-communicable diseases, NCDs. These are lifestyle diseases. They are chronic diseases. They are caused by lifestyle choices that people make. And this is from the World Health Organization. NCDs are by far the leading cause of death worldwide. The world is reaching an inflection point. This is serious language. 15 million people will continue to die each year from NCDs in the prime of their lives. Most of these deaths tomorrow can be avoided. So these are statistics from the World Health Organization for India. And what are these diseases? Cardiovascular disease, hypertension, heart disease, heart failure, cancers. 50% of cancer is preventable. Respiratory diseases, type 2 diabetes, obesity, other NCDs like depression, anxiety. These are the major challenges in modern society. In India, NCDs are estimated to account for 63% of all deaths. In Western countries, like the United States and the UK, 90% of all deaths are due to NCDs. In the United States, 90% of all of the healthcare costs, the finances supporting healthcare, is due to NCDs. This is the major challenge in modern medicine. So what are the risk factors for NCDs? There's three major risk factors. Physical inactivity, we're becoming a sedentary society, sitting too much, not getting physical exercise. Poor healthy diet. High levels of processed foods, refined foods, pure sugar, low value nutrition, high fat content, high carbohydrate, high calorie content, and then unhealthy behaviors like cigarette smoking, excessive alcohol consumption. And what is also underlying our society is an epidemic of chronic stress. Every country in the world is showing high levels of chronic stress in modern society. And this is exacerbating all of these conditions. These are due to behaviors, both of the mind and of the body. So what is the cure for an epidemic of lifestyle disease? Lifestyle change. If you want to really be successful in treating a lifestyle disease, you have to change lifestyle. Does our modern medicine change lifestyle? Not very well. This is the acute care model of modern medicine. It's true in the United States. It's also true in India. Its focus is on symptom treatment rather than the causes. It's a disease-focused approach, not a patient-centered approach. It's not a healthcare system. It's a disease care system. It's invested in pharmaceutical, surgical, and technological strategies. It's incentivized to emphasize speed and high volume. Health maintenance responsibility is on the provider, on the doctor, not on the patient. And prevention and health maintenance is not dominant in this system. So it's not very good at changing lifestyle. It's giving you a pill just to treat the symptoms. That will not work. You cannot treat an epidemic of type 2 diabetes such as you have in India with a pill. It's not going to work. You have to change the lifestyle. Modern medicine is not focused on changing lifestyle. It's not good at changing lifestyle. So the focus is not where it should be. It's not focused on prevention. It's focused on treating the symptoms. And nobody is turning off the main cause. This is not going to be successful. And we know it's not being successful because the epidemic of NCDs is continuing. So, what about yoga? What can yoga do? Let's compare what yoga has to offer versus these risk factors. So we have the physical fitness aspect of yoga. This is going to address this whole area of physical activity. People become more confident in their bodies, they exercise more. The self-regulation of stress and emotion can take care very well of this chronic stress. There is no pill in modern medicine for stress. In fact, doctors are the most stressed people. In the United States, over 400 physicians commit suicide every year. There is no solution to stress. They are experiencing burnout. Yoga has the ability to manage stress. There is nothing in modern medicine that can do this. Mind-body awareness is the most important thing that can change these behaviors. Because you become more sensitive to your internal functioning, you become aware of the consequences of your behavior. So you practice yoga for a few months, and then you go out and you eat some junk food, and you say, oh my God, I feel awful. I used to eat this food all the time, and I never noticed any difference, but now I feel awful. I'm not going to eat this anymore. I can't stand it. And then you go and you have an alcoholic drink or a cigarette, and you say, oh, that feels awful. Why did I ever like this before? It's because you've become more sensitive. You've increased your mind-body awareness. The same thing works in the positive direction. So you go on a hike or you go to the gym to exercise and you say, wow, I feel so good. How come I used to do this before and I never felt this good? It's because you become more aware. Now you eat some good food and you say, wow, that feels really good. I want more of that. I want to continue to eat good food and get exercise. This is lifestyle change, not from the top down. You must do this. This is the things you must do. Go home and do this. No, this is from the bottom up. I want to change. I want to do these positive behaviors. So yoga really, through this mind-body awareness, has the solution to lifestyle change. And research is starting to support this. And then finally, this is not insignificant. When people start to experience these deeper spiritual states, they start to have more respect for their bodies and their minds. So they change their lives to focus on their health. Not only their health, but everything else. They become more sensitive to the environment. They say, I'm more sensitive to the environment. I want to help the environment. It's important to address climate change. So this is not insignificant and also helps with chronic stress because it changes your perspective. Most of the people in society, their goals are materialistic. I want to become wealthy. I want to become famous. I want to become a powerful politician. These do not lead to life satisfaction or happiness. But when we have these spiritual goals of I want to become a better person, I want to be more calm, I want to be more kind, that is a recipe for life satisfaction. And that reduces stress as well. So yoga has everything that we need to address the ills in the modern healthcare system. Modern medicine does not have a pill for any of these. So we have in yoga what modern medicine needs. So research on yoga as a therapeutic intervention is undergoing a very strong increase. This is from PubMed. And what I did here is I searched for papers with the title of review or meta-analysis. Each one of these papers surveys many studies that were done. So in 2000, there were none. None, zero. In 2023, we had almost 70 reviews or meta-analyses of research done. So look at this remarkable increase in the yoga research over that period of time. This is really amazing. My first visit to Kaivalyadam was 2001. So for me to see this change over time is really amazing. And we have published this book, The Principles and Practice of Yoga in Healthcare. We had 23 chapters in this book by 60 international yoga researchers, many of them from India, where we summarized in each chapter the research evidence supporting yoga for each of these types of conditions, the science and the research. So this is a medical textbook. This is our passport to modern medicine. This is saying that yoga has scientific credibility. And just to conclude with just a few examples in our studies in our laboratory where we've seen changes, remarkable changes. This was a study that was done on post-traumatic stress disorder, very common disorder, especially in modern society. And what we studied was yoga for 8 weeks. And we had two groups, one that practiced yoga, one that did not. This is the PTSD scores of severity. This is the yoga group. You can see reduction in the PTSD scores significantly by the end of the treatment. And the controls that did not practice yoga had no change. We also measured resilience to stress, and you can see that increasing in the yoga group. Perceived stress was decreased in the yoga group, and another measure of stress was also decreased in the yoga group. So yoga can treat post-traumatic stress disorder. Modern medical pharmaceutical interventions are only 50% effective. So this is very important to have another therapy that truly treats the underlying cause of the trauma. We've also studied chronic insomnia. Chronic insomnia occurs in almost 30% of people. It's largely due to chronic stress. So it's an epidemic as well. Sleeping pills are not a solution. It's treating the symptom. Many people will take sleeping pills for 20 years. They stop taking a sleeping pill, their insomnia comes right back. If you do a behavioral treatment, you can cure the insomnia so that it does not come back, and you are treating the underlying cause. So we have done a clinical trial of yoga for chronic insomnia. And after 8 weeks of daily yoga practice, we were able to see that the time taken to fall asleep in these insomniacs was reduced in the yoga group in the purple here. And that the long-term follow-up was much more reduced. This is a sleep hygiene control condition. And total sleep time went up as well. We also saw an increase in sleep efficiency and the efficiency of sleep over the course of the night, and a reduction in the amount of time that they are awake in the middle of the night. Again, many of these people, the insomnia does not come back because they have addressed the underlying cause. So I am supported in part by the Kundalini Research Institute, which supports the style of yoga that I practice, which is Kundalini Yoga. I'm also supported by the International Association of Yoga Therapists, which is the largest organization of this kind. It has 6,000 members. The goal of this organization is to accredit yoga therapy schools, to certify yoga therapists. They have a trade journal called Yoga Therapy Today. They have a peer-reviewed biomedical journal called International Journal of Yoga Therapy, and I'm honored to serve as the editor-in-chief of that journal. They have an annual meeting called the Symposium on Yoga Therapy and Research, and they support a meeting that I host, which is the Symposium on Yoga Research, and we're coming up to the 14th annual iteration of this Symposium on Yoga Research. This is our opportunity to build the field, to bring trainees, to bring experts together, to share information, to train each other, to make collaborations, and to advance the field of yoga research. And I conclude with this slide. This is not just American, so you're not off the hook. This is international. This epidemic of NCDs is international. Physical and mental health is deteriorating. Modern medicine has no fix for this, although it tries with pharmaceuticals, with surgery. What we need is the implementation of yoga in society. The most important place to put yoga in our schools. Learn these practices. That is another place we can put it is in the healthcare system to provide true solutions to the underlying causes of these disorders. And we've also done research on yoga in the workplace. Bring yoga into the businesses because many businesses, many occupations have high levels of stress. So we need the research on yoga to justify, to support the implementation of yoga into the schools, into the healthcare system, into the workplace. Research is necessary. The policymakers that make the decisions, the government officials that make decisions need to see the research evidence so they can justify this incorporation of yoga into mainstream society. This was the vision of Swami Kaivalyananda. And to be here on the 100th anniversary of Kaivalyadam is really remarkable, to see how much we have come forward with that mission that he started so long ago. So when we have more research, we can then start to change this cartoon, hopefully, to this cartoon. So thank you for your attention.
Do you want to share with them now?
It's up to you.
You can do it.
Sure.
Sorry. Okay.
Happy to take any questions. Yes, ma'am. Yes. So the question is, can the elderly benefit from yoga practice? I am 72. And I have had yoga practice since I was 21. And I am still standing and still running and still walking. And yes, even the elderly who have had a terrible lifestyle, we have now yoga for the elderly. We have many studies on yoga for the elderly. Now, the elderly are not asked to do headstands and handstands. That makes no sense. But they can do what we call chair yoga, learning how to flex, to breathe, to meditate. These things anybody can do, regardless of their physical ability. And chair yoga is very beneficial. And the studies are starting to show that yoga is very powerful in the elderly. It helps them reverse a lot of the symptoms that come with aging. And there is now very powerful research that shows that some of the brain deterioration is decreased with yoga practice. Some of the regions of the brain are reducing their structure and their size. That's what happens in aging. In aging, everything starts to disintegrate. With yoga, you reverse that disintegration. So absolutely, yoga is extremely beneficial for the elderly. Yes, the brain, especially because what's the point of being older if you have dementia, if you have Alzheimer's, if you have no longer the ability to brain function? I mean, that is what it means to be a human being. So that ability to maintain brain health can be facilitated with yoga.
So I have just coined an acronym called yoga, and it stands for, all of this we understand, young and old gender-free application is yoga. Young and old gender-free application is yoga.
Yeah, absolutely. Very good. Yes, ma'am.
My question is,
Yes. Yes.
that comes as a
this was a quote from the paper. I think they were being a little facetious about this. Having said that, it's important to understand that mind wandering is not evil. In fact, mind wandering is a source of intuition that helps us solve problems and generate, solutions to life. Animals don't have mind wandering. Mind wandering, you are analyzing the past, predicting the future. That gives us a survival advantage. Mind wandering is also the source of much creativity in art and music and so on. So mind wandering is not evil. Mind wandering becomes a problem when it becomes too much. When you spend all of your time mind wandering, you are then no longer in control. Your thoughts and your mind wandering are in control. So the whole idea is to generate some degree of self-regulation. And that is what makes the difference. And this whole idea of metacognition, it is the same construct behind the most powerful form of psychotherapy today, which is called cognitive behavioral therapy. And in cognitive behavioral therapy, you learn to recognize dysfunctional thinking. You learn to recognize your thought processes, and you become more of a master of your thought processes. So this is the whole idea of mind wandering, is that not to eliminate it. Nobody can eliminate mind wandering. Even the most experienced masters have mind wandering during their meditation. So you can't eliminate it. You don't want to eliminate it. You want to bring it under good self-regulation. And that's what we're talking about with respect to mind wandering. And we're showing that people that spend too much time mind wandering, they are at risk for disorders like depression, anxiety disorder.
Okay, one last question.
Down here, yes. Good morning.
So when you approach the people understand this.
Yes.
So they people make the public. The people they want to repeat it.
Ah, yes. You've hit on a very, very important point in modern medicine. And this is because the public has adopted the acute care model of medicine. The public now believes, I don't have to do anything. The doctor will take care of it. I can sit on the couch all day long eating jalebis and watching television, and there's no problem. When I get sick, the doctor will give me a pill. I don't have to do anything. That's not going to work. And because of that, when the doctor says, you have insomnia, I can give you a sleeping pill, or you can go and do an 8-week cognitive behavioral therapy program with yoga, but you have to come once a week. You have to practice at home, and it takes 8 weeks with slow recovery over time. The patient says, I'm too busy. I have no time for that. Give me the pill. That is the mindset of modern society. And that is working together with the medical model. So not only do we have to change the medical system, we have to change the general public in the way they view their own bodies and their minds. The public must be responsible for their own health. This medical system is upside down. In Chinese medicine, the medical system used to be that the doctor was paid only when you stayed healthy. If you got sick, the doctor didn't get paid because the doctor failed. Modern medicine, the doctor makes money when you get sick. So the impetus is in the wrong direction. And patients are in this belief system in modern society that they don't have to do anything. There's no maintenance. People have more maintenance of their cars than of their bodies. If you don't get an oil change in your car, the engine falls out. So you take your car, you maintain it because you don't want to lose this big investment that you made. But people don't get regular exercise, eat good food. They don't maintain their own bodies. So this is a major problem, not only in the medical system, but in the population as well. And the two must change together. But the doctors, if they recognize the importance of lifestyle, can make this change to the public. So this is a very, very important question. Thank you for the question.
Thank you, sir. And with that, we will just end this first round of discussions over here. We have the next session. Right now it's 10:50, I guess. So let's meet sharp at 11. So please take some rest, a water break, and we'll meet again. So let's just chant one time Om, and then we can take our water break, or maybe just some fresh air outside, and come back sharp at 11. Let's close our eyes. Breathe in. Let's chant one time Om before we start. Make yourself comfortable and centered. Let's breathe in. Om. Please open your eyes. And now I request Shri Satbir sir to begin with the second session. Thank you, sir.
Thank you. So I've been asked in the second presentation to focus on a specific area in the field of medicine, and that is, of course, psychology, psychiatry, specifically in the experience of anxiety, which is not only an everyday experience, but also has a range of what are called anxiety disorders. So I'm going to start by talking about what anxiety and anxiety disorders are, so we have an understanding of how to move forward. And like a lot of mental health conditions, there are now very modern definitions that are very precise. 50, 100 years ago, these definitions were very vague. There was this term called neuroticism, which is no longer used. It is now very precise that each mental health condition has very precise definitions and characteristics. To give you one example, post-traumatic stress disorder. No one knew what this was really until World War I, for example, until it was called shell shock in World War I. And they had no idea that this was actually a disease. And now there are very precise definitions of post-traumatic stress disorder and treatments that are very specific for that disorder. The same is true for anxiety. So what is anxiety? It's an unpleasant mental feeling of worry, concern, or dread. It has both physical, emotional, mental, and behavioral components. I'm going to come back to this because this is very important. It has physical components, not just mental components. It can come with or without psychological stress. It should not be confused with outright fear. It's more of a dreaded feeling about something which appears intimidating and can be overwhelming. It's a normal response. Animals also experience anxiety. It may help an individual to deal with a demanding situation by prompting them to cope with it. Actually, there's an ideal amount of anxiety. When you're giving a talk like this, if you're too relaxed, your talk will be awful. You have to have some level of anxiety to help you perform a little better. So a certain amount of anxiety enhances performance and functioning. But the problem is when it becomes too great. When it's overwhelming and interfering with daily life, it may be a clinically significant anxiety disorder. Now, the most important anxiety disorder, there are many different types of anxiety disorder, such as phobias, like phobias of height or phobias of snakes, phobias of spiders. But generalized anxiety disorder is probably the broadest and type of anxiety disorder. It is excessive anxiety and worry occurring more days than not for at least 6 months about a number of life events or activities. The person finds it difficult to control the worry. Anxiety and worry are associated with 3 or more of the following 6 symptoms that are present for at least 6 months. So restlessness, feeling keyed up on edge, easily fatigued, cognitive impairment, irritability, muscle tension, sleep disturbance. So it's very precise in the way it's defined and diagnosed. Anxiety causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. And the anxiety is not explained by some other kind of drug or circumstance. So this is a listing of the physical symptoms. Now, remember, this is a psychological condition. That's the way it's talked about, a mental health condition. But these are the physical symptoms that are part of this mental health condition. Increased physical stress response symptoms, sleep disturbance, and a list of other symptoms: fatigue, headaches, muscle tension and aches, difficulty swallowing, trembling, twitching, irritability, sweating, nausea, lightheadedness, breathlessness, hot flashes. Some of these or all of these can occur with this disorder. So the important point I'm making here is that although this is classified as a mental health condition and is treated by psychologists and psychiatrists, like all mental health conditions, it's actually a mind-body condition. And that is important because in modern medicine, we have 2 aspects. We have psychiatry and psychology, and we have physical medicine. And they have a wall between them. They don't talk to each other. The physical doctor doesn't talk about stress or emotion, and the psychiatrist doesn't talk about physical body. It's crazy. We are not minds in jars, and we are not physical beings. We are mind-body individuals, and there is no distinction between mind and body. What affects the body affects the mind. What affects the mind affects the body. So to take a disorder like this and say we're going to treat it by mental techniques, that's half the job. Why not use mind-body techniques? That's what yoga is. So let's talk about yoga for anxiety. And I showed you in my last presentation this model of how yoga works on the mind and on the body. It works on the body. It improves physical functioning, flexibility, strength, coordinates, balance, respiratory function. We talked about fatigue. We talked about insomnia. We talked about restlessness in the body. This can improve that, and this is a yoga practice. We talked about stress as being a possible driver for some of the anxiety. We talked about stress symptoms in the body. That's self-regulation. Anxiety is an emotion. It's generated in the emotion centers of the brain. Yoga is capable of regulating emotion. In order to be aware and treat a disease, you have to be aware that you have the disease. Many people have a disease and don't even know they have a disease. They're that disconnected. As you increase your mind-body awareness, you become aware of the subtle changes of any kind of dysfunction before it becomes serious. And that allows you to cope with it. How can you treat something if you don't even know you have it? There are so many people walking around with anxiety that are undiagnosed. They don't even know that they have this disorder. So this mind-body awareness is critical. Metacognition. Cognitive behavioral therapy is the most powerful form of psychotherapy for treating anxiety disorders. And the major underlying construct in cognitive behavioral therapy, as we said earlier, is metacognition, and meditation, I believe, leads to metacognition. And then, of course, spirituality. If you are experiencing the entire universe as one flow, and you are in this deeper state of consciousness, experiencing the entire flow of the universe, how does that compare with an anxiety experience? That can be something that takes you out of yourself and into the higher self. And that can deal with anxiety. So all of these factors have relevance for the treatment of anxieties. So this is the rationale. We improve in self-regulation of thought processes to reduce dysfunctional anxiety-related thoughts. This idea of metacognition, what you think, these dysfunctional thoughts and anxiety, the anxiety thoughts, they are not a symptom of the disease. They are the disease. And when you stop those dysfunctional thoughts, the disease goes away. People don't understand that. That's why cognitive behavioral therapy works, because you change your thought processes, and then the disease goes away. So that's critical. You get an improvement in mind-body awareness and mindfulness to increase awareness of anxiety-related physical, cognitive, and emotional symptoms. This mind-body awareness allows you to self-regulate and therefore deal with this problem. The improvement in stress and emotion regulation and stress and emotion reactivity on the physical level. You become aware of the physical symptoms of anxiety. You can address that from the body. There are studies that show that simple aerobic exercise on a regular basis can improve anxiety. So just getting more into your body with physical exercise. Even in trauma, there's now meta-analyses that show that aerobic exercise has positive improvements in trauma. That's true for all mental health conditions. The more you get exercise, it has an impact through the mind-body connection. And then finally, as I said, these deeper experiences of unitive states improve overall life perspective and life purpose and meaning. They broaden your consciousness. Anxiety is very much me, myself. When you experience this state, it's me and everything. So there is a lot of information about yoga for anxiety. There are now books that have been published on providing yoga strategies for treating anxiety. This is one example, Yoga for Anxiety. This is another one, Vini Yoga Therapy for Anxiety. There's a book by my colleague, a Yoga and Cognitive Behavioral Therapy Together, a workbook for treating anxiety. If you go online to the Yoga Journal is recommending all of these postures that you can use for treating anxiety. So what is the research that we have so far on the evidence for the fact that yoga might be able to treat anxiety or anxiety disorders? We're talking about anxiety and anxiety disorders for now. Well, in the book I mentioned that we have the Principles and Practice of Yoga in Healthcare, we have a whole chapter on yoga therapy for anxiety. This covers all the research that's been done on yoga for anxiety. And there are published meta-analyses of studies that have been done. This is by my colleague Stefan Hoffmann, who's now in Germany. And they concluded from this analysis that Hatha Yoga is a promising method for treating anxiety. And they looked at 17 studies. This is by my colleague Holger Kramer, also in Germany, one of the up-and-coming leading yoga researchers in the world. And their review, a systematic review and meta-analysis of randomized control trials. This is the forest plot, which shows everything on the left-hand side of this vertical line in these particular studies showed improvements in anxiety. And you can see most studies are all showing improvement in anxiety. Going back in history, you have a history here. This is from Yoga Mimamsa, 1971. 53 years ago. This was a study done on a summer program. 55 individuals came in a summer program and did yoga here. And what they measured was anxiety. These are the results here. 55 subjects, and they had the anxiety symptom questionnaire. So the initial conditions before yoga, the score was 29.67. And final conditions after completing the yoga dropped from 29 to 13. So very clearly an example of improvements in the experience of anxiety. And the conclusion in this study was that there was significant reduction in total anxiety scores in the normal subjects after yogic practices as compared with their initial condition. These results indicate that yogic practices may prove useful in reducing the anxiety level in the person. If spiritual exercises like puja, mantras, prayer, concentration, and meditation are practiced with relaxative asanas in one's daily routine, it may prove more effective in reducing the anxiety level or expression in the person. So there are more recent studies, and I'll just show you a few of these. So this is retrospective data. What they looked is at people who had been practicing yoga for a long time, long-term yoga practitioners. And they asked them through the profile of mood states, which has an anxiety subscale. These people completed this questionnaire. And they compared them with a control group of people that did not practice yoga. And you look at the tension anxiety scores, you can see that the long-term yoga group has lower experience of anxiety than does the control group, 6.95, 9.86, and this is a statistically significant difference, which suggests there's something about long-term yoga practice that makes your anxiety level lower. Other kinds of surveys have asked about why people practice yoga. Why have you come to yoga practice? And this was a survey that was done in Australia in yoga practitioners. 58% of respondents gave reduced stress or anxiety as a reason for starting. 79% found this to be a reason for continuing. In other words, only 58% said, I'm coming to yoga because of anxiety. But when they ask, why are you still doing yoga? That increased to 79%, suggesting that they have now experienced the benefits of yoga, and this is now a reason for them to continue because it is helping with their anxiety. And they concluded of those who reported using yoga for specific health or medical condition, more people used yoga to address stress management and anxiety than for back, neck, or shoulder problems, suggesting that mental health may be the primary health-related motivation to continue yoga practice. And this is another study. This is asking now to long-term yoga practices, do you perceive that yoga is good for your anxiety? So here on this question here, 96.8% said they found yoga to be helpful for their anxiety. So you ask a yoga practitioner, does yoga help you cope with your anxiety? The answer is very much yes. Now, the problem with these kinds of studies is that they are so-called retrospective. These are studies done on people who have already practiced yoga. And so the argument can be made, well, people who have low anxiety are attracted to yoga. The yoga didn't do this. These are already low anxiety people. This makes no sense. This is not proof. And they are correct. The research design will not answer that question. So what you have to do is prospective studies. Take people who have never practiced yoga, give them yoga, and see if it improves anxiety, as they did in that study at Kaivalyadam and published in Yoga Mimamsa. So we have seen some of this in our own work. This is a trial that I showed in my previous presentation on yoga for post-traumatic stress disorder. And we measured a measure of anxiety in that group. You can see at the baseline, these trauma patients both had high scores of anxiety in both groups. The yoga group showed declines at mid-treatment and even more so at post-treatment, more so than did the controls that did not practice yoga. We've also then studied yoga in generalized anxiety disorder. This was a casual study by a clinical psychologist who studied her patient population. She did measures of anxiety before, gave them the clinical yoga treatment, and then measured anxiety afterwards. And you can see and she combined this together with cognitive behavioral therapy. So yoga plus cognitive behavioral therapy, two behavioral therapies together. You can combine behavioral therapies, it's no problem. And what she found was reductions in state anxiety, trait anxiety, and even panic symptoms. So this is another study that followed up that same protocol, now using yoga plus cognitive behavioral therapy. And again, what they showed is reductions from 44 down to 36, and that was statistically significant reduction in the scores of state trait anxiety. We worked with another clinical psychologist who used yoga alone, just yoga by itself, without cognitive behavioral therapy. And also, we were able to show statistically significant reductions in anxiety on several different questionnaires that measured anxiety, all showing improvements. Now, we were able to take that data and apply for a grant to our federal agency in the United States, which is called the National Center for Complementary and Integrative Health. This federal agency funds integrative medicine practices like yoga, meditation, tai chi, qigong, acupuncture, homeopathy, etc. And using the pilot data that we got from those studies, we were able to get a grant. This was a major grant. This was $4.5 million from the American government for a 5-year study. And we were very fortunate in getting those funds because that allowed us to do this study. So the primary aim of this study was to compare 3 treatments. One was Kundalini Yoga. It's a form of yoga that I've been practicing most of my life. That is very popular in North America, Europe, China. And we compared that with cognitive behavioral therapy, which is the gold standard for psychotherapy treatments for generalized anxiety disorder. It's the most powerful. And we compared that with a stress education attention control condition. This was meant to be relatively ineffective, but there were common sense recommendations in there, so it's not completely ineffective. And these were to be compared with the non-inferiority tests, and both of them compared to the stress education control. So we had 2 active conditions, Kundalini Yoga and cognitive behavioral therapy, and 1 inactive control condition. We recruited 230 patients with the primary diagnosis of generalized anxiety disorder. So this is a very clinically rigorous evaluation of their anxiety according to modern standards. So they had to have significant generalized anxiety disorder. This was a multi-site randomized control trial. It was conducted at Boston University and Massachusetts General Hospital at Harvard Medical School, 2 sites in Boston. We had 95 subjects to be assigned to Kundalini Yoga and to CBT each, and 40 subjects assigned to stress education. This was a 12-week intervention. We had 2 instructors in each group. This was done in group sessions, so 2 instructors, and a group of format of anywhere from 4 to 6 subjects. And this was the same for all 3 interventions. So we had 2 yoga instructors together instructing these 12 weeks, once a week, for 2 hours. They had daily homework. Every day, they were to do 20 minutes of yoga. We gave them a very specific yoga practice. It was intensive treatment integrity and compliance monitoring. We recorded all of the sessions to make sure that the instructors were delivering exactly the routine. Everything was done according to a manual, so it was very rigorous and very carefully controlled. The outcomes we evaluated bi-weekly, every 2 weeks. At the end of the treatment, and then 6 months later to see the follow-up if the treatment had long-term efficacy. We also had many secondary aims and analyses to look at mediators, moderators, and mechanisms. So, for example, we measured heart rate variability, we measured sleep, and a number of other factors to see how other things were changing in this population, because people with generalized anxiety disorder also have some degree higher levels of insomnia, higher levels of stress, etc. So this was the diagram of how these patients were assigned and actually ultimately randomized. We had over 500 patients consented at the beginning of the trial, but only 226 made it to the randomization phase. So we had 95 in the Kundalini, 93 in the Kundalini Yoga, 90 in the cognitive behavioral therapy, and 43 in the stress education. And these numbers pretty much held up towards the end of the long-term follow-up and included in the analysis. These are the many different outcome measures we looked at. So the major thing was the SIG-A, which is a primary measure of anxiety, symptoms of generalized anxiety. And we measured a number of other measures: quality of life, worry, insomnia, and so on. And then we had another measure of mindfulness and metacognition. So a lot of outcome measures measured at multiple points over the trial. So very rigorously done, lots of outcome measures. So these are the interventions. The Kundalini Yoga, as taught by Yogi Bhajan, is a popular style in the United States. It is a traditional form of yoga practice that incorporates postures, breathing, relaxation, and meditation and mantra. We had, in each 2-hour session, we spent 10 minutes talking about home practice, the importance of maintaining your practice on a regular basis throughout the study, because that's important. We actually did the home practice in the session. We had some talk on the theory and philosophy of the yoga practices, 15 minutes of pranayama, a full yoga asana set of 50 minutes, another a specific breathing meditation for 15 minutes, and then a 20-minute home guide practice that they were supposed to practice every day at home. The cognitive behavioral therapy was a standardized protocol developed by the Boston University Center for Anxiety and Related Disorders, and this is a leading organization in the field of treatment of anxiety. There were 4 primary treatment modules: cognitive restructuring, progressive muscle relaxation, worry exposures, and in vivo exposure exercises. So mostly it was cognitive, but they did also incorporate progressive muscle relaxation. The stress education was psychoeducational information about the stress response, consequences, role of genes, lifestyle behaviors, importance of exercise and diet. But there were no active therapeutic practices in cognitive behavioral therapy or mind-body techniques. And their home practice was to listen to psychoeducational audio lectures. So this is the home practice that we used. They did simple spinal flexes for 1 minute, combined with the inhaling, synchronized with the spine flexing. Spinal twists with the hand on the shoulders, inhaling to the left, exhaling to the right for 2 minutes. Shoulder shrugs, inhaling the shoulders up, exhaling, lowering them down. Slow neck rolls with slow breathing in both directions. And then the cat-cow spinal flexes, inhaling to cow, exhaling to cat. And as you can see, these are simple breathing and loosening exercises to bring people into their bodies, to release their physical tension, to quiet them down. And then for 11 minutes, they did a segmented pranayama, inhaling in 4 sniffs, exhaling in 8 segments. And they were instructed to breathe as slowly as possible with that pranayama technique and add to this some kind of mantra, whether they would choose to use sa, ta, na, ma, or I am. And this was done for 11 minutes at home. So altogether, this is 20-minute home yoga practice. These are the results. And we were very fortunate because this was a very rigorous, strong trial. We were able to get this published in the Journal of the American Medical Association Psychiatry, which is one of the major medical journals. And we now have yoga publications in fewer than 10 JAMA papers. So this is really significant. This is very important for yoga research to try and get published in these leading medical journals. So we were very fortunate because of this trial was so well done. This is the response rate in terms of recovery from the disease. And what you can see is the cognitive behavioral therapy is the winner. This is no surprise, because cognitive behavioral therapy has been developed over the past 30 to 40 years and optimized to be a very powerful, very successful treatment. This is Kundalini Yoga. You can see how close we came. Now, both these treatments were statistically significantly better than the stress education control condition at 12 weeks, but at the 6-month follow-up, only CBT was better than stress education. Nevertheless, we were very happy with these results. This is the degree of improvement we see with cognitive behavioral therapy in the first large randomized controlled trial of yoga for GAD. So we are very happy with this outcome. Now, we've done a number of studies to look at all the other data that we've had, and we've been continuing to publish these papers analyzing all of the other data from the study. This is another one that we looked at. This is the impact of preference for yoga. People indicated whether they preferred to be in the yoga group or preferred to be in the cognitive behavioral therapy group. And these are the outcomes based upon their preference at the beginning of the trial. And we need to plug the computer in before we lose power. And what you can see still here is the preference match. So people that were not matched are indicated. Oh, we lost it. Oh, there it is. So based upon the treatment arm, the yoga group is in the solid line and the black line, and the CBT group is in the gray line. And so preference did have some effect in terms of the benefits and the outcome. We also looked at sleep quality, because generalized anxiety disorder patients have a relatively high level of sleep disturbance. And what you can see is that they're all clustered here at the beginning. And the two groups that declined more are the CBT and yoga groups. The stress education group did decline, but not quite as much as the yoga and CBT in terms of insomnia. And the group that had the greatest decline, Kundalini Yoga, started way up here and then came way down here. So suggestion that the yoga is actually working very well for the insomnia. We've also looked at comparing the Kundalini Yoga, cognitive behavioral therapy, and stress education on anxiety and depression outcomes. No significant differences were detected between participants receiving CBT or those receiving yoga. In other words, effects on depression were the same in both CBT and the yoga. We've also looked, and this is now published and accepted for publication. We looked at mindfulness, changes in mindfulness. And what you can see again is, and you can see the stress education had much less of a change. So improvement in the acting with awareness facet under this questionnaire, the 5-facet mindfulness questionnaire, were significantly greater for Kundalini Yoga than CBT. So there might be a benefit that yoga has over simple cognitive behavioral therapy. So this needs more work. We need more work to show whether certain aspects of the yoga intervention are adding things that CBT is not able to address. So, and this raises another point about the future. Where should we go with this? Well, CBT is primarily a cognitive therapy, and yoga adds the pranayama, the physical components, the meditation component. So it makes sense to move towards combining these together to make a better intervention, to control some of the things that CBT is not covering as well, perhaps this mindfulness component. So for the future, one way to go is to do a large trial with yoga plus cognitive behavioral therapy to show improvements. Another important place that we can do this is to look at cost effectiveness. Compare these yoga treatments to get against pharmacological treatments to show the differences in cost and the differences in long-term outcome. And if we can show that yoga costs less than pharmaceuticals and has longer-term benefit because it's truly an underlying cure, that makes a very strong argument for the implementation of yoga into modern treatments of anxiety disorder. So again, I'm supported by the International Association of Yoga Therapists, as I've said, and I conclude with this yoga therapy cartoon. Okay, your posture's very good. Now relax, concentrate, and slowly let go of your mobile. So thank you for your attention, and I'm happy to answer any questions.
Yes, over that. While others keep their attention to me. So I have a question. I'll first ask first question. So I want to understand when you spoke about metaphysics and
Yes.
but like foundation when the started put under the bed.
Yeah, so I think one comes from the other. And I think the first thing in cognitive behavioral therapy, you are trained to pay attention to your thoughts. And you're trained to recognize a thought as being anxiety related. And then when you start to practice that, you start to identify, oh, that was an anxious thought. I'm worried about tomorrow. And then the strategy is, when you notice that, you change it. Oh, tomorrow will be okay. I'll manage. You replace that thought with a neutral thought. And as you practice over time, you become more sensitive to recognizing those thoughts. And then you also recognize dysfunctional beliefs. Oh, I'm in an anxious state. I never used to be this way. Oh my God. And you recognize that that's a dysfunctional belief, that many people have anxiety. It's okay. We can deal with it. So you start to become more aware and more attuned to those thoughts. Finally, you reach a point where you are very good at replacing those thoughts. And ultimately that transitions into, those thoughts don't bother me anymore. I no longer have those thoughts. In fact, I'm aware of the fact that because I can control my thoughts, I'm not my thoughts. Because I can change them, I can be aware of them. That recognition, that realization is referred to as metacognition. So that's how cognitive behavioral therapy works. Meditation is slightly different. You focus your attention on a mantra, on a candle, on a yantra, whatever. And then mind wandering comes in. And you recognize that intrusion. And you say, oh, I bring it back. You are learning to control your own attention. And you constantly now become more attuned to the intrusion of mind wandering. You become attuned to the consequences and the kind of thought that is intruding. And then you are able to bring it back. And over time, you realize that, hey, because I can control them and no longer react to them, I'm not my thoughts, obviously. And that is an experience of metacognition. So the two, I believe, lead to the same outcome. But one thing I will say about yoga and meditation versus just cognitive behavioral therapy. Yoga and meditation, because it's a meditative practice, for whatever reason we don't understand the neurophysiology, you can ultimately have these unitive states of consciousness, these experiences of unitive consciousness, samadhi, this flow state, transcendence. I'm not aware of any studies that show that CBT can lead to these kinds of states. So there is something that yoga and meditation have that CBT does not have, and that is this deeper potential for spiritual experience. But both of them share this ability of self-regulation of thought processes. And that self-regulation leads to the realization, because you are able to self-regulate, that you must not be your thoughts, because you can regulate those things. So that is me versus them, as opposed to me being them. That's the difference.
societal structure, which is I could go there, get married, take care of people. But there was one slide that spoke about when I was a now with the lack of awareness of the what you can different stages of my life, different stages of life.
So I think this is a question that addresses the thing of what kind of meditation or what kind of yoga should I practice? And what is a secondary question, what would be the best kind of practice for helping me cope with life? As you know, there are now many, many different contemplative practices. You can go practice Isha Yoga with Sadhguru. You can practice Art of Living with Sri Sri. You can go and practice Patanjali Yoga with Baba Ramdev. You can practice transcendental meditation. The list goes on and on. I was just at a heartfulness conference. You can practice heartfulness with Daji. So there are now multiple different opportunities for the types of contemplative practices. And people are, for whatever reason, attracted to different types of practices. But that's fine. That's diversity. That's personal preference. You might prefer a Toyota. I might prefer a Suzuki. We have different preferences. And different preferences are important because that gives us different opportunities. So that is one aspect of preference. It's whatever you prefer, that's fine. But when people ask me, what is the best type of practice? What should I practice? But because we know that asana alone has an impact, that pranayama has an impact, that deep relaxation has an impact, why not use all of them? That's why I prefer yoga. And when people ask me what kind of yoga, I say, go for a yoga that incorporates everything. Traditional yoga, not just asana, but a traditional yoga that incorporates all of the components, because then you have the greatest odds of success because all four of those components are providing some kind of benefit. And the other thing about that is that when people adopt that style, they may focus more on the pranayama. They may focus more on the relaxation. They may more focus on the asana. They can choose whichever works best for them. So yoga gives you a smorgasbord, as they say. It's a buffet. You now gravitate towards the paneer because you like it more. And that gives you more satisfaction, as opposed to going just for the khichdi. So, this is the advantage of a contemplative, multi-component style of yoga. Because in the West, we have now many, many styles of yoga. And some of them are just asana, nothing but asana. But you are better off doing a contemplative type of yoga, which incorporates all of those four components. It's a whole series of disorders called attention deficit disorders. And in the name, you can actually see the solution. Because yoga increases awareness and control of attention. What could be better for an attention deficit disorder than improving your attention deficit by increasing your ability to attend? And that is starting to be found. We are seeing studies both in children and in adults that yoga practices are proving positive benefit in ADHD. And like all mental health conditions, ADHD not only has cognitive symptoms, but physical symptoms. So once again, the advantage of a mind-body intervention like yoga for a mind-body condition like ADHD. And so there is a growing body of studies showing positive benefits in ADHD. It's not as big as the research in some areas of yoga, but your relationship to your plans, to your society, to your parents, to your previous goals. And that change is always in the positive direction that leads you to more integration, more life satisfaction. And the most obvious example of that is the businessman who wants to make $1 billion. I want to be the richest man on the planet. That's my goal in life. That person has a knee problem. His secretary said, if you go practice yoga, you can fix your knee. So he says, okay, I'm going to yoga to fix my knee. He goes to yoga practice. 2 months later, his knee is better. But he says, something else has happened here. I went to yoga for my knee, but I no longer have this goal of being the richest man. It has no meaning for me anymore. And all of this competition that I was in and this striving for wealth, it's immaterial to me because now I've experienced some deeper changes. My perspective on life has changed. I'm no longer interested in being the richest man in the world. I want to be the happiest man in the world. And that is involved with these kinds of new decisions that are made. And this person now may change his relationships. All the other people he was interacting with, all the same people in the same materialistic goal of life. And he now says, I no longer have anything in common with these people. I'm going to the yoga center. I'm going to hang out with those people. I'm going to an ashram for a few weeks. I'm going to a yoga resort where I can talk to people which have the same kind of goals and ambitions. And that moves on to deeper changes. I want to serve the planet. I want to change the climate. I want to take my skills and help humanity. I want to serve the poor. I want to build more trees. I want to plant more trees. These are the kinds of evolutions that take place when you start to experience those deeper states of consciousness. Because in essence, those states of consciousness are unitive states. You are experiencing the one. You are the universe. And when you are everything, then everything affects you. And that means when I throw a piece of garbage on the street, I'm part of that street. I no longer want to do that because I'm essentially harming myself. You understand the nature of karma because you are the universe. And so now you have more respect for your body, for other people, for the planet. So these are the kinds of evolutions that take place with contemplative practices. And that's why you see all of these leaders, whether it's Sri Ravi Shankar or Sadhguru, having these incredible planetary initiatives where they're talking about helping poverty, helping the planet, building trees, et cetera, et cetera. This comes out of this kind of change in consciousness that comes with regular contemplative practices like yoga. So that's a very broad answer to a very specific question. So I think, that's what, there was a whole movement in the field called integrative medicine, in which we are focusing more on these behavioral type of practices to deal with problems. Modern medicine is not meaningless. There's a lot of virtue in modern medicine. To get diagnosed, to get proper information about what your disorder is, modern medicine is still the best. Because you can do an fMRI, you can see which part of the brain, you can see if you have a tumor, you can see whether your heart rate is fast, you can see whether you have high blood pressure or not. So modern medicine still has value in diagnosis. And then when it comes to treatment, depending upon how severe your treatment is, you may need to do conventional therapy if it's a really severe disease. But if it's something like insomnia, that's not life-threatening. Then you can go immediately to a holistic type of therapy. But if you have cancer, if I had cancer, I would get chemotherapy, radiation therapy, no problem. But I would also, of course, do complementary practices like more yoga, more meditation, more natural therapy, etc., more holistic practices as well. So it depends upon your circumstance and the kind of disorder. But you don't want to throw away conventional medicine. There are still things that are good in conventional medicine, but there are a lot of weaknesses, and that you can supplement with. That's why we call these complementary and integrative medicine. They add to what is offered in modern medicine. Well, you've been run by the British for a few centuries, and that did not do much for traditional medicine in India. That was suppressed. You now have a British Western medical model, which is also skeptical about yoga. I can say that the Western approach to medicine has never provided an integrated approach. It was always divisive. In the 1800s, they split psychiatry from physical medicine. They divided the body and the mind in modern medicine. So modern medicine really has not had a tradition or a practice that was integrative. You have to come to the Orient to see that kind of approach, whether it's from China with Tai Chi and Qigong or yoga from India. That's where these more holistic approaches have been sustained. But modern medicine, Western medicine has not really provided that kind of transition for people. In fact, doctors themselves are the most stressed people in the world. They have the highest levels of burnout. They are leaving the profession because they can't tolerate the stress. They don't even have strategies in modern medicine to help the doctors survive. So we are now starting to see studies have done on yoga for medical students and yoga for medical doctors to help them cope with their own profession. So that's missing in Western approaches and missing in Western philosophy. The only thing that we have in Western philosophy is very small field of mysticism, and it's very small, but it's not been related to the rest of the medical system. The mysticism is about this unitive state of consciousness, experiencing samadhi. That's what mysticism is, and there have been Western mystics as well as Eastern mystics. So, but that has been really in the corner of the closet. It's not been a part of mainstream Western society at all. So, really, the East has provided a lot of information for the West in terms of lifestyle, philosophy, and ultimate happiness. Yeah, so they're on the same level. Simply because one is to the left and one is to the right doesn't mean that one is better. I can reverse them. But typically self-regulation in practice tends to come first. When you practice yoga for the first time ever, your first yoga class, what you experience is self-regulation of stress. It's not until a few weeks later, when you've been doing a little more meditation, you start to become more sensitive. So in fact, the experience of self-regulation appears to come before the awareness. However, the two are very tied. In my model, I have arrows between the boxes. And there's a problem because we read left to right. And you might think that, the body is the worst and the spirituality is on the top. But they are all interconnected. So, but in terms of time frame, there is a sense that the self-regulation becomes before that. Because if you do slow breathing, you automatically relax, regardless of your awareness. You start to relax because physically you are driven to this relaxation from the asanas, from the pranayama, from the deep relaxation. And then as you add the meditation component, you start to become more and more and more and more aware. And in the studies that we've done, when we measure scores of mindfulness and scores of stress, they all move together. Stress, resilience, and mindfulness all move together because they're part of the same mechanism. So they are tied together. I think they all are working simultaneously. I mean, I've had someone who told me that in their first yoga class, they had a samadhi experience. My God, this guy was so lucky. I mean, some people practice yoga for 10 years and never have this. So it's very inter-individual. And different people have different experiences on those four components of practice. So it is variable, but because humans are variable. People have different genetics, they have different backgrounds, they have childhood upbringings, and so they have different experiences in the way these practices affect them. So it's difficult to be totally generalistic and say everybody does this. Some people are exceptions. That is a real phenomenon. And when people ask me, what style of yoga should I practice? I believe you. I see all your data. I want to practice yoga. What should I practice? I already explained that it should be, a multi-component holistic yoga is probably the best choice. But I also say, you must shop. You must evaluate what is out there and make a very careful and a very informed decision. Because if you don't, you will not get the best result. If you want to buy a car, this is a major investment, a lot of money. Do you just walk down the street, first car lot you come to, salesperson says, buy this car, you buy it? Why would you do that? You may not be satisfied. You have no idea what this car can do. It may find out to be that it's a lemon or it doesn't work properly, it doesn't go as fast as you want. When you go to buy a car, you shop. You go online. You evaluate every different car model, mileage, repair records, etc., comfort, cargo space. Then that's not enough. Then you walk to the car dealers. You test drive a car. You test drive another car. You go to another car dealer. You test drive that car, you test drive this car. After weeks of shopping and evaluating, you say, I found the car and the car dealership that is perfect, and I buy that car, and you have high level of success in your satisfaction with that car. It's the same with yoga. There are so many yoga styles, so many meditation styles. You have to shop. You have to look online at what all the different practices are and fit them to what you want out of yoga. Then you have to go to the yoga studio and you have to take the classes. Not just one class, because the one class can be very specific. You take multiple classes. Not only do you take multiple classes, but you take classes from different teachers. Because a different teacher in the same yoga studio can give you an entirely different experience. And so you do that. And then you find, after going to 3 different studios and practicing 5 sessions in each studio with different teachers, you say, this one gave me this incredible experience. That's where I'm going. Every Wednesday night, every Thursday night, every Saturday night, I'm going to that yoga class with that teacher because that hits the spot. That's perfect for me. And the reason you need to do that is because if you don't find that, you will not continue. When you find that teacher and that style of yoga, you say, this makes me feel amazing. I am always going to go to that class. Wednesday night is my yoga class. Nothing is going to be scheduled on that day because I am committed to that. I need that for my life. That kind of relationship to the yoga practice means that you will continue practicing yoga, and that's where you get the benefits. I have heard so many people say to me, yeah, I tried yoga once. One yoga class, one studio, one teacher, and that was it. And that teacher may have been incompetent. It may have been a style that had nothing to do with them. And that's their experience of yoga. And they say, I practiced yoga once. It's no good. Well, yeah, that style and that teacher was no good for you. But unless you do the shopping, you cannot identify that. And teacher is very important because different teacher in the same style of yoga can give you a very different experience.
Who are present today here, we all are committed to yoga in some or the other way, and but surely during our path we all get our doubts, puzzled that if we have made the right choice, and a session like this obviously reaffirms that and validates our choice that yes, we are on the right path. So a big thanks to Satbir sir for re-establishing that faith in the practice and bringing such an objectivity and profound knowledge to a subjective experience like yoga. And he is a bright example for us, like how we all even can gracefully age, be more wise and profound. Like 2 hour session here, and he made it look so effortless. So thank you, sir.